If you've been told you have spinal stenosis but don't fully understand what that means, this will help you make sense of it. A lot of patients hear the term spinal stenosis and immediately assume something serious or irreversible, but most aren't giving the clear explanation of what that actually means and what's happening in their spine. I'm Dr. William Moyal from Coral Gables Center in Coral Gables, and one of the most important things we do is help patients understand their diagnosis before making any decisions. Spinal stenosis simply means a narrowing of space in the spine. And when that space narrows, it actually puts pressure on your nerves. That narrowing can happen for a few reasons. This changes over time, thickening of surrounding structures, changing in joint alignment and movement. As that space becomes tighter, nerves can become irritated or compressed. That's why people with spinal stenosis often experience lower back pain, neck pain, pain that radiates into the legs or the arms, numbness or tingling, weakness in certain cases as well. And in many situations, symptoms get worse with standing or walking and improve with sitting. One of the biggest misconceptions is that spinal stenosis automatically means surgery. That's not always the case. The severity of what's seen on imaging doesn't always match how someone feels. Some people have significant narrowing on their MRIs in minimal symptoms. Others have more moderate findings, but more noticeable discomfort. That's why the diagnosis has to be evaluated in context, not just based on imaging. There are cases where spinal stenosis becomes more serious, especially when there's significant nerve involvement or loss of function. Those situations need to be evaluated carefully. But many people fall into a category where the condition can be managed if the underlying cause is properly understood. And that starts with looking at both your MRI and your symptoms together. If you've been diagnosed with spinal stenosis and want to understand what it actually means for your situation, visit my website using the link below and book your consultation today so we can go over your MRI and discuss the right solution for you.